I'm Tammi Martin. I live here in town. I live on Pickpocket Road. I am the chair of a group called the New Hampshire Healthy Schools Coalition, which was formed in 2002 by the then sitting Surgeon General, who identified the obesity epidemic. And I recognize some faces from when I have visited with the chamber. So we'll try to talk about some new and different things. A little over a year ago, I was also asked to join the Partnership to Fight Chronic Disease, which makes perfect sense because the main area that I work on with New Hampshire Healthy Schools is to reduce the incidence of childhood obesity and increase the fitness levels of children, making it more likely that they can perform better in school. And I'm also the vice chair of the Governor's Council on Physical Activity and Health, so only in New Hampshire can you wear so many hats and try to figure out which hat you are wearing on any given day. So I've tried to put together some small slides so that we could have a quick discussion, and then maybe I could answer some questions regarding what's going on here in New Hampshire. So as you can see, the partnership is really working to educate, mobilize, and challenge people to come out and be part of this initiative to improve the health of children. There are lots of ways that you can do that, and I know as a service group that you're already focusing on kids. In my, prior to 2 years ago, prior to that, I spent 20 years as a professor of health management and policy at the University of New Hampshire. And my area of expertise was the cost effectiveness of healthcare delivery systems. So I know firsthand how important it is where every dollar is spent. And as we were discussing while we were eating breakfast, we can't even really get our hands around what the costs are going to be 15 or 20 years from now if we can't address the health of children now. There are, I would say, and you can see the statistics here for yourself, chronic disease is the #1 issue that is driving healthcare costs up in the U.S. currently.